So I work at Navigo, which is a community interest social enterprise not-for-profit organisation in North East Lincolnshire, covering a population of about, I think it's about 135,000, so it's quite insular and it's quite rural. It's an old fishing community, so there's a lot of social deprivation. It's got one of the highest areas of social deprivation in the country, so we have a lot of people presenting crisis, things like that. So 2008 we started looking at new ways of working. We were typically big old wards. We'd already met Molly and Jen, and she started us on a good journey to sort of social engagement. We were already part of the AIMS project with Royal College. We joined that in the pilot scheme. We were given £14 million at that time to build a new hospital. We struggled to find land. We couldn't find the right site. So it took us a couple of years to actually find the right place to build, and then it took us about a year to build it. And we moved in there in 2010. At the same time, we were looking at what was happening with crisis teams nationally and home treatment. And we thought, there's a lot of rumbling around, people saying that crisis teams aren't working. We decided that we would amalgamate crisis home treatment teams into the inpatient wards. Met with a lot of resistance, a lot of women and ahhing, a lot of the senior staff voted with feet, left us, went out into the community or went elsewhere. So we quite a challenge. So at that time, 2008, we started delivering crisis and home treatment from the inpatient areas. So gatekeeping our own admissions. And I say own because at that time I was the ward manager. 2010 we moved into Harrison House, which is purpose-built. We've got a brilliant, who's now chief executive, was clinical director at that point, who said, go out and build me something. Involve service users, involve staff, don't involve me as long as I can have the doors and the carpets that he wanted, which he got. Still regret getting carpets. Brilliant, it's quite a maverick. His name is Kevin Bond and is a man that you would want to meet and be inspired by. It's hotel standard. We don't have NHS supplies. We go where we want, we use local suppliers, we buy beautiful furniture. If things get broke, we replace it. If it gets broke tomorrow, I'll have it fixed next week. We don't put TVs in boxes, we put them where we have them at home. We have cushions, if they get tatty, we throw them out, we go buy some more. I did this last night actually, the pictures are a lot smaller, that's the kitchen. We also have our own ancillary service run by Duke's Project, which is a national award-winning scheme. That started in 2003. It was really small. So we do all our ancillary work. We don't have porters, we have concierges. We do some of our catering across the whole of mental health. They have a conference centre, external catering. They've just actually built our new disorder. So it's a massive project. And it goes right down to now where they've taken over the floral hall in the local park and running like that. So for myself, I've got 2 10-bedded units and a 5-bedded enhanced care unit with over 6 suites. Accredited to Royal College. To deliver a service of crisis home treatment and inpatient, staff need to be flexible. They need to be able to work across the site, and we move staff to where the need is greatest. So our enhanced care unit, last week it wasn't open, and we sent staff to other areas to sort of intensively work with other people. An enhanced care unit, we can open it, patients can come up for a few hours, they can come up for a day, they can come overnight, or they can come for longer. And along with most other people, we've got a directive at the minute to reduce out-of-area budgets and start getting people back home. We relaunched Brocklesby Lodge, which is the enhanced care unit, in April. We've now only got one person out of area, and that's by his choice. Staff attitudes, it's really important for us. On the national survey last year, we were 81% on staff who felt that they were able to deliver the care that they aspire to be. And that was compared to 69% nationally. And then our strapline is that we deliver a service we would want our family to aspire to receive. And so 80% of staff felt that we were delivering that compared to 60% nationally. So therapeutic engagement, back in 2007, Royal College identified that people were bored on acute units, there was no activities, as along with Marion and all the Star Awards. I think it's on the next slide, of course. Marion's been up to our unit a couple of times now, and she's a real inspiration, not only to myself, but to a lot of the staff and to a lot of the service users who still remember her visits. So we do a lot of Star Awards. We have daily coffee mornings now. We used to have community meetings, now we have a coffee morning. We have a weekly community meeting with the couple of reps come from the local forum, and our housekeeper goes to that, some of the staff go to that, and we do feedback. And then we also cook on 2 of the acute lodges. We cook 2 main meals twice a week, and we cook tea on the weekend. We're given the budget to do that, so it's an activity for the whole day on 2 lodges. So they sit down with coffee morning, and they'll plan what they're going to do for the day. What would we like to eat today? What's the weather like? It often influences what you're going to eat. And then they'll sit down and plan. Staff and service users will go out and do the shopping. We'll go to the local market, we'll go to the local supermarket, go to one that's in someone's local area, depending on where they live. And they'll come back, and the afternoon is spent planning, cooking, preparing. The smells that you get on the units on a Monday and a Thursday is phenomenal, and I don't know how we're ever going to stay slim or get slim. So really, really good. On the weekend we have a cooked meal delivered to us, cooked on the site by our tube service, and then to do a lighter lunch, a lighter tea on the weekend. So we'll do the same thing. We'll plan what we're going to do today. Make it more adventurous because we don't get much money on the weekend. It's a really tight budget. And so it's got to be creative. It's got to be nutritional. And we look at nutritional, people's diets, people's dietary intake. So that's what we're doing with that.